I do feel tired. When I go there, I do feel tired. It's partly because of my age. My energy level is very low. And that's why I've stopped going out. One, because of my energy level, and second, because of transport. The home doctor comes once a month, but he is available on the phone. That's how I prefer to have a home doctor.
Dr. Louis has assisted me in a major way for the hospital, and he showed me where it is necessary for the doctor to treat me.
In Kenya, where hospitals are often far away and the cost of care keeps rising, a quiet revolution is transforming how Kenyans heal one step at a time. Healthcare in Kenya poses a significant financial and emotional burden on families, especially those battling chronic illnesses like cancer and cardiovascular diseases. According to the World Health Organization, 5.1% of Kenyans spend more than 10% of their household on healthcare, underscoring the urgent need for affordable alternatives. Recognizing this need, Island Family Medicine was founded in Changamwe, Mombasa County.
Or whatever drove our motivation into starting those programs is because we thought every person has a right to have primary health care, but they also have a right to get specialized health care in time and for the right price. The reason we are coming into such an equation is because tunajaribu to reach out to the very remote people. Because first of all, our consultation is free. Teleconsultation, we can do video conferencing, we can also do WhatsApp chat that is encrypted end to end. Na kama unahitaji maybe any prescriptions, ndo isifike time maybe the patient ana misuse whatever prescription they are given, we normally do e-prescriptions to their pharmacy, to the pharmacy of their choice.
Island Family Medicine began offering home-based care services in early 2020 during the spark of COVID-19 pandemic as a response to the rising need of accessible healthcare. Since then, it has become a key player in Kenya's home-based healthcare landscape, delivering affordable and reliable clinical and supportive care directly to patients' homes and especially the elderly.
Okay, the motivation was around the fact that people were really afraid of visiting hospitals. Na sana sana it was a bit of some sort of a stigma kwa sababu ile aspect ya kuwa ukienda ukipimwa ama ukionekana uko na symptoms you'll be quarantined. So the motivation was kuna wakati our terminally ill patients actually wao ndo walikuwa na challenge zaidi ya kwenda hospitali, because kama unakumbuka COVID ilikuwa ikikushika na uko na ugonjwa mwingine chronic, your symptoms will be worse, like you'll be more affected. So the fact is, hiyo time yenye hawa patients hawakuwa comfortable kuja hospitali, we used to don our PPEs, tunaenda tunawaona, if it's injectables we needed to give, if it's treatment, we started treating them from home. And if maybe ilifika time they needed admission, kuna wengine hata they actually needed admission to ICUs, and we actually directed them to the right care, na wakapata usaidizi na wakapona. Then tukaona, I think it's something we can really practice and make it official.
Mr. Hussein Popat, 84-year-old, is a resident of Koja Flat, Mombasa County. He has prostate cancer and heart disease and has been under home-based care for over 3 years, which has been a lifeline for him.
Yeah, almost 2 to 3 years, Dr. Ali has been my home doctor. And he comes to visit me regularly. I'm a heart patient. I also have a prostate cancer, and I'm okay, I'm all right. My prostate cancer is under control. I take regular hormone injections. My heart condition is okay. I've been treated and I'm on a lot of medication. And Dr. Ali comes every month to check on me and check on my medicines. And he has been a very impressive doctor. I am very satisfied with him. I am not mobile that much. I have a car which has got a low suspension, so I have a problem in getting into it. If I have to go to any hospital outside, I have to hire a high suspension car, and hiring and driver and fuel costs almost 5,000 shillings. So I prefer to be looked after at home. But I have to go occasionally to Coast General Hospital for my cancer checkup.
According to his house manager, Sadam Jao, home-based care has not only been a convenient but also life-saving.
Tumekuwa tukishughulikiwa kutoka hospitali nje, lakini ikafikia mahali inakuwa ni ngumu kwa yeye kuweza kutoka nje, inakuwa ni ngumu kwa yeye kuweza kupata matibabu nje kwa haraka. Mara nyingi ukienda hata hospitali hizi kukuu inachukua muda mrefu sana kumuona daktari. Sasa nyingine tunahitaji daktari, pengine tunahitaji tu maagizo ya daktari. Ikabidi tutafute daktari wa haraka. Kuna wakati mmoja alikuwa anafanya kama ambaye ameconverge upande mmoja. Tukapewa jina la daktari Dr. Ali. Na daktari Ali alitusaidia sana kwa sababu alifanya kutupa maagizo tufanye namna gani mwanzo kabla afike. Kuanzia muda ule amekuwa daktari wetu wa karibu. Ule umri aliofikia si umri wa kuzungushwa kila sehemu, anachoka sana. Sasa unaona ni heri tukua na daktari wa nyumbani kuliko kutoka nje kwenda kutafuta daktari nje. Inatuchukua muda mrefu sana. Na mara nyingine pia kupata njia za usafiri inakuwa pia ni ngumu. Lakini kwa daktari kufika kwake kwetu inakuwa ni rahisi.
Mr. Ismail Hassan Hambie is 66 years old from Old Town, Mombasa. He has a heart disease. He has had a successful coronary bypass surgery and a feeding tube insertion. Both procedures facilitated through the home-based care program.
Gonja ameanza just recently of heart blockage. I had 5 blockage and I've been operated in Nairobi, Medihill Hospital, you know. So first I came here in Mombasa, I got Dr. Louis, and he assists me in everything, in my medical, in my problems, and he sorted out everything. He's the one who showed me the way of heart, because here in Mombasa I did not know.
My dad has been patients for Dr. Lube as in home care services. Some years back, my dad alianza symptoms. Tulikuwa confused sote what was happening. But because of his immediate help and guidance, ndo pale tukaja kujua kumbe it's heart problem. Yani paka kutu guide paka kwenda Nairobi for ile surgery, and then we came back, and after coming back ile paka his full recovery, he's always been there for us yani.
So we made this process seamless from the initial diagnosis or initial examination to the local cardiologist to the referral to Nairobi to going to theater and coming back. So after coming back from theater, the recovery has not been easy. And I would really say, like I said, patient akiwa discharged, now it's the business of the relatives and the patient wajue kule wataenda na chenye watafanya. So now sisi tumekat hiyo sasa. We want to follow up this patient paka ile time yenye atapona.
A 2023 report based on the 2021 Kenya Time Use Survey and the National Care Needs Assessment revealed that 40% of Kenyans, about 19.2 million people, need some form of care service. And with the population aged 65 and above expected to triple by 2045, this need will only continue to grow. Mr. Kia Mwavivi, 83 years old from Miloweni Village, Kasemeni Ward in Kinango Sub-County, Kwale County, has been having a long-standing prostate enlargement with urinary inconvenience for over 1 year. He successfully underwent surgery through the home-based care program.
Napatwa ni ukongo nikipata mwanangu ambaye ni hali waluvi, ambaye mwana yiye ni mtu ambao unaelewana na kinonya sanjira. Kwa hivyo henda bidii uze vyako potrisi na kuza kuhala potrisi na alafu nda kuvirika kwenye uganga ukapate uganga oro kwamba uoni wakokola uwe na vyakala vivyo kweli. Nikienda nikionyeshwa ye daktari nikifanywa uganga wo lavua mikojo kwanza kwenda pima kumanyikana ukongo wani, halafu nikitiwa operation. Sambi hali zangu kidogo ni mbizo, lakini yere kwamba ni hali ambaye ni mwanangu yona wasiliana hata juzi wanipigira na kinusa na kimambira viratu ambana sikira.
For the past 3 years, Dr. Kolo Luvi with his team has been on the move, from Mombasa's bustling estate to quiet village along the coastline. The team has 5 trained and polished nurses, 3 clinical officers and 2 medical officers. In addition to that, they have direct partnerships with several consultants and high-level hospitals to ensure seamless referrals and access to specialized care.
So ile waiting time sometimes mtu hapati the right service in good time. By the time anakuja maybe ugonjwa umecomplicate and it's not even easy to beat the disease. So tulijaribu kukame in that kama namba zetu na communication handles zetu zitagawanywa kwa kila mtu anaweza piga simu, tutamsikiza, we'll jot down their problem, we'll find out what they actually need. Kama anahitaji a specific specialist, we work with several specialists all the way from surgeons, from gastroenterologists, from radiologists, every specialist in each field of medicine tuko now. Our program has nurses that can offer service around the clock, bedside nurse. We also have programs whereby we can meet a patient on a schedule, like twice a week, for example, once a week.
Since 2020, Island Family Medicine has served more than 100 patients, bringing healing to doorsteps and easing the burden on hospitals across Kenya. Despite the challenges on financial limitations faced by clients, particularly those residing in remote areas, they aim to expand their services in future to include point-of-care ultrasound, point-of-care x-rays, among other mobile diagnostics, preventive, curative, and palliative services.
We have a number of agreements with certain hospitals whereby tuseme kama watu wametravel, kuna watu wenye wako on long-term medication, but treatment doesn't have to stop you from living for that matter. So kuna watu wenye wanatoka even outside the country, na watu maybe local tourists, they come to to hotels in Mombasa and they are on follow-up medications. Maybe you are started on certain antibiotics, umekuja kwa hoteli, you do not want to miss those doses, and you also do not want to sit in a hospital. So we have arrangement with those hospital managers and HRs. Wanakuja wanatuambia, this is the patients we have right now. We take down their details. We provide the services they are supposed to get, and we also sometimes provide first aid services.